Building value in hygiene is a big issue. Okay, and we've talked about this. Again, I review countless reports for Henry Schein every year, and we often identify missing hygiene patients. Look at this one. I don't think there's any coincidence there. Okay? So it's almost like when we have missing hygiene patients and we're not going after it, it's a tremendous opportunity for us. Okay? So sometimes there's a lot of patients that are missing, and maybe they're missing because we really didn't do a very good job of building value in hygiene. Okay, how do we build value? Again, and when we look at the potential production increase, just recovering those 600 and change new patients, it's a production increase of over $300,000. In your practice, Dr. Messer, you've got missing patients. I know it because everybody does, but I would assume that if you kind of tried to back off a little bit and you weren't, driving as you were, I bet you've got quite a few missing hygiene patients that translate to an incredible amount of revenue, which is why I said as soon as you have your doctor, get another hygienist on staff and start working some of those reactivation plans and things that we teach, because there's tremendous opportunity in missing hygiene patients. In fact, this is another area when we run those reports, it's often stunning what those missing patients translate to in productivity. Okay, so one of the ways we build value is we do risk assessment. I was thrilled to hear Dr. Hood's team yesterday say this is what we do. We do CAMBRA, we do risk assessment. This is the tool that we have for that. And again, it's not all that difficult. We can take a brand new hygienist right out of school, teach them the language on risk assessment, teach them how to present fluoride, and all of a sudden we're a rock star with fluoride acceptance. And we love to see that. Okay, so this is Taco Bell now serves breakfast. Did you know? What drink, what beverage do they promote as a part of their Taco Bell breakfast? The Mountain Dew Kickstart. Isn't this awesome? Okay. I just did a presentation at my son's school last week called Teenagers and Teeth, What You Need to Know. And this is one of the things that we talked about. Pictures of Mountain Dew mouth. Over time, it's as damaging as meth. Patients don't know this. These poor high school kids, the favorite part of that whole experience was the video that I showed about how many bacteria are transferred with the 10-second kiss. They loved that. All right. So I was like, I just ruined your weekend. But anyway, so good stuff. So they need to know this stuff, right? We talk about pH a lot. We talk about what that means. This is part of building value for hygiene, having this conversation about risks. The nice thing is the marketplace is starting to provide us with some awesome resources. This is a brand of bottled water. Did you know you can purchase alkaline water? 8.8 pH. Love it. Okay. How many of you are utilizing the Essential Smiles that has the essential oils plus the xylitol? Patients love that. They love being able to have that as an added resource. They're going to spritz that if they have a Mountain Dew or they have their Diet Coke. They're going to use that spritz right afterwards to neutralize the pH of the oral environment. Okay, so there's a lot of things we can do to help build value for hygiene. Children's programs. February's Children's Dental Health Month. If you're looking for a way to network in your community and drive awareness in your communities, I believe we did a training on that. It's on the member website. We have an awesome children's program. Okay, you can do some of those things out in your community. Pediatrician's office. Go do some of these lunch and learns with other professional offices, and it can help drive referrals. Okay, so there's a lot of opportunities out there to build value for what we're doing, especially for young kids that end up with cavities, right? So we know what's happening. That's a vertical transmission of bacteria that's happening from parent to child. This is a spoon that's been in the mouth of a baby. I found a really great video last night. I haven't added it yet. But it's a dad playing a game with his infant, and the infant's just laughing like crazy, and that's what's funny. But what's the guy doing? He's got the kid's pacifier in his mouth, and every time the kid pulls it out, like he spits it out or whatever, and the baby starts to laugh. And I'm like, okay, that's awesome for entertainment. Like Holly says, keep them busy so you can, what did you say? Get a quickie, all right? So if you're looking for entertainment value, it's great. But when we look at bacterial transfer, it's probably not the best strategy, but they don't know what they don't know, right? Okay, so this is what we're dealing with, is building value. I love this image. This is a powerful image because this shows the progression of decay. Right, here's the earliest possible stage, maybe a tiny bit of a white spot. And then we see a bigger white spot. And then we see deterioration all the way through destruction. Okay, so building value for hygiene is not all that difficult. It's just the matter of having that conversation, chairside with patients and helping them see why it is that these visits are important. Some patients may need cleanings